Hi, my name is Brenda Ceballos. I go to talking about comparing the predictive factors of salivary alpha-amylase and dental enzyme for intraoperative pain in patients undergoing dental extractions. Definitions: alpha-amylase is a digestive enzyme that hydrolyzes alpha-1,4 bonds of large polysaccharides, sacs, and starch and glycogen, yielding the smaller byproducts of glucose and maltose. Alpha-amylase is synthetic in the acinar cells of saliva glands and stored in secretory granules inside these cells. Its release from the salivary cells is greatly increased in response to states for chewing motions of the jaw, in addition to its digestive functions. Alpha-amylase also plays an important antibacterial role in the oral cavity. For these reasons, it is present in lower levels in non-stimulated saliva between meals.
All sorts of enzymes occur naturally in our bodies. Some help digest food. Amylase is an enzyme in saliva which breaks down starch. Enzymes are usually large protein molecules. They speed up reactions. Imagine this is amylase. It helps break down starch into smaller maltose molecules. Without an enzyme holding the large molecule in position, this reaction would be extremely slow.
Recently, ESAA has emerged a reliable biomarker for objectively assessing patient pain. Separate studies have also found a relation between choral dental enzyme scale and patient pain. Pain perception is not simply a physiological experience. Emotional state can modulate pain, and there exists a reciprocal interplay among dental fears, dental pain, and the body physiological response.
So today we're going to be investigating some factors that affect enzyme activity. We're going to be using the enzyme amylase, which is found in our saliva and is part of our digestive process. Amylase is a catabolic enzyme that catalyzes the breakdown of starch into glucose. So starch is a polymeric substance made up of monomers of glucose. The starch fits into the active site of the amylase enzyme, and the amylase then catalyzes its breakdown into its subunits. Amylase is also being used currently in laundry detergent to break down the starch in food stains. So we're going to be looking at some of the properties of laundry detergent that might affect how well the enzyme actually works. You might want to investigate the temperature that the detergent's used at, the acidity or the pH of the laundry detergent, the concentration of the enzyme actually in the detergent, or the concentration of the starch in the stain. To do that, we're going to monitor the breakdown of the starch by the amylase enzyme over time using the starch iodine indicator system. So the way that works is that iodine in the presence of starch actually turns a very dark blue or black color, as I'll show on our spotting tile. When no starch is present, as would be the case when the amylase has broken it down into glucose, the color remains amber or brown. We're going to be using a spotting tile like this to check the concentration of starch present every 30 seconds. So to start off with, we have our amylase enzyme our pH 7 buffer and our starch solution all measured out, and we're going to place them into a 40-degree water bath. We're going to leave them in that water bath for about 5 minutes so that they all come up to the same temperature, and then we'll get our reaction started. So now that they've had time to get up to temperature, we're going to mix the amylase and the buffer together. So we'll pour them in. And again, we're going to leave it for just 1 minute this time to let the enzyme get used to the pH. And once that's ready to go, we'll then add our starch to start the reaction. So now that it's had time to equilibrate, we're going to add our starch solution to the buffer and amylase to get our reaction started. Once we do that, we're going to take our first initial time measurement by taking a drop out of the reaction mixture and putting it onto our spot tile to react with the iodine. Then, every 30 seconds, we're going to do the same thing. Take a drop out of the reaction mixture, place it into the iodine well, and see if there's any starch present. It's also really important to put anything that's in the pipette back into the reaction after we've finished spotting so that the reaction can continue at the same temperature all the time. So let's get started. So we've reached the 2-minute mark and the reaction has moved to completion, as we can see that the iodine is no longer darkening. Therefore, the amylase has broken down all of the starch that was in solution into glucose. Now it's your turn to design an experiment to test one of the conditions we spoke about before. So you might look at how temperature affects the activity of the enzyme, how pH affects the activity of the enzyme, how the concentration of the enzyme affects activity, or how the concentration of the starch might affect it. Good luck.
There is relationship between a patient dental incisor and intraoperative extraction pain. A study did not find that pre-operative SAA factors, concentration and output rate, were related to either base extraction pain or DAS score. A strong positive relationship was observed between the concentration of SAA and the rate of SAA output. Based on the result of our study, we conclude that dental incisor has a moderate but significant correlation with intraoperative dental pain. Given the study time frame and resource, a convenient sample was used to achieve the necessary sample size. It is likely that patients with severe dental incisor refused participation in this study were more likely to receive intravenous sedations or were less inclined to seek treatment at taking clinic. Confounding factors to self-analysis such as eating or drinking 1 hour before collation and current medication were all self-reported.
Tooth extractions in experienced head is generally a quick and painless procedure. I remember when I had my wisdom tooth extractions, I couldn't feel any pain. I could still feel some pressure or pulling and minor tugging happening in my mouth. Most of my patients at the end of the procedure will ask me, "Is that it?" That was quick. It's nice to hear that patients have not felt anything during the extractions and they are relieved at the end of the procedure. After having extracted few thousand teeth, I can reassure you that the dental extractions in our hands will be a quick and a painless procedure.
Dental procedures involve a high situation of stress and anxiety. There was no difference between this group and the non-anxious group when comparing sex and pain. The HAA level increased in day surgery when comparing anxious, eventful, and non-anxious patients, while ES levels were higher during the interview and post-operative follow-up.
Wisdom teeth, or third molars, usually enter the mouth between the ages of 17 and 25, a time of life that has been called the age of wisdom. When a tooth is blocked by another tooth, or grows in a manner that makes it impossible to enter the mouth normally, it is said to be impacted. Many people have one or more impacted wisdom teeth. This video explains how third molar surgery can help prevent later problems in your mouth and teeth.
If wisdom teeth are to be extracted, we like to remove them when patients are younger, late teens or early 20s, because it's an easier surgery for patients. The bone is more forgiving, the teeth aren't fully formed, and we don't have to worry about the roots being close to important structures like the nerves in the lower jaw and the sinuses in the upper jaw.
You know, the problem with third molars is that they often do not have enough space to grow into the mouth. For some patients, the teeth do come in, but are so difficult to keep clean that it's better to remove them so that they do not develop problems that affect the teeth in front of the third molars. Sometimes these teeth are stuck or impacted underneath the gums. That gives them the potential to develop cysts and cause other problems later in life. Because the likelihood that impacted third molars can cause problems now or problems in the future, they are generally recommended for removal when a person reaches the late teens or early 20s.
Many orthodontists refer their patients to an oral surgeon for wisdom tooth extraction to alleviate hygiene challenges and minimize the possibility of gum disease, cavities, and other problems that could affect the success of orthodontic treatment.
If your orthodontist recommends extraction, you'll meet with the oral and maxillofacial surgeon beforehand. The surgeon will evaluate your particular situation and may perform certain diagnostic tests. For surgery, it's very important that the mouth be clean. We ask patients to brush and floss their teeth as usual. Wisdom teeth are usually removed under general sedation, although sometimes only local anesthesia is used. Patients who will receive an intravenous anesthesia should not eat or drink for 6 hours before surgery. Finally, it's best to go to surgery wearing loose and comfortable clothing.
The oral and maxillofacial surgeon selects the method that is best for each patient. The length and complexity of third molar surgery depends on a number of factors. It includes the position of the tooth, the length and curvature of the roots, the thickness of the bone surrounding the teeth, and the patient's overall physical condition and health. In general, a young adult's wisdom teeth have incomplete root systems, making tooth removal relatively uncomplicated. As wisdom teeth continue to grow, their roots lengthen and may become tangled with the sensory nerves that run through the lower jaw. When that happens, surgery is more difficult and complications are more likely. If the tooth is impacted, an incision is made in the gum tissue, which is turned back so the tooth can be seen. If bone is covering the tooth, Some of it may need to be removed in order to expose the tooth. This tooth may be removed in one piece, or in some cases, it may be cut into sections. The removal of 4 impacted wisdom teeth usually takes 45 to 60 minutes to complete. Once the wisdom teeth are removed, the gum tissue is sutured. Following surgery, patients rest under supervision in the oral surgery office until they are ready to be taken home. Before leaving for home, patients are given specific post-surgical instructions and prescriptions, including pain medication.
The best outcome is the ability of patients to be able to properly maintain the rest of the teeth they're keeping. Long term, patients can expect to experience improved dental hygiene and ease of home care.
For more information about third molar surgery, contact your orthodontist or your oral and maxillofacial surgeon.
Based on the result of our study, we conclude that dental ensair has a moderate but significant correlate with intraoperative dental extraction pain. Vaseline is a concentration and output rate do not appear to be related to this experience. Other contributing factors, such as salivary cortisol, are yet to be assessed in the context of dental treatment.
Are you deathly afraid of going to the dentist and you have a lot of anxiety just thinking about going to the dentist? Well, my name is Michelle and I'm a dental assistant with Solutions, and I'm here to help you on how you can get over your dental anxiety. Really, there's not a full way that you can completely get over your anxiety, but first and foremost, what you would want to do is you would want to approach your dentist about the anxiety that you're having, make him aware of the situation and how you feel about coming to see him. Don't feel bad at all. A lot of dentists get it. 9 times out of 10, most of their patients do not want to go to their appointments to go see the dentist. It's a very common thing with dental anxiety. A lot of times what onsets dental anxiety is if you've had a bad childhood experience or you just hear horror stories about other people's bad experiences. But basically, you would need to approach your dentist, make him aware that you feel this way, and he might want to prescribe you maybe some Valium, which is a muscle relaxer. What that does, you would take that an hour before your appointment, and it really just pretty much relaxes you. It puts you at ease before your visit. Also, too, he might want to prescribe that you might want to administrate nitrous gas during your procedure, which is just a mask that they put over your face and you breathe in the nitrous gas with oxygen. This is also another form of like a muscle relaxer. It just really like relaxes you during the procedure, really just takes your mind off of it. But pretty much getting over your dental anxiety is something that you would need to approach your dentist about, and therefore he would be able to walk you through it a lot better and maybe prescribe you some Valium to help you get through that appointment. But once again, my name is Michelle and I'm a dental assistant with Solutions, and I just explained to you on how you can get over your dental anxiety.